Rose, hi.
Hi.
How are you going?
Yeah, better now, thanks. I didn't know what was going on for a while there.
Rose lives with multiple sclerosis. She was recently admitted with a severe bladder infection, which led to a temporary delirium. Her sister Mary and her partner Jenny had conflicting ideas as to what should happen after this hospitalisation, whether more care at home was needed or whether inpatient rehab could also be useful. It looks likely that there'll be another time when Rose won't be able to make decisions for herself. Given the conflict between Mary and Jenny, it is important for Rose to consider identifying a decision maker and her preferences for care. Yeah, so we did have a little bit of an issue when you were out to it.
Yeah, I heard there was a bit of a disagreement while I was out. I'm sorry about that. I don't think Mary really gets that Jenny and I are a couple. She makes things really hard for Jenny.
Look, don't worry about what happened, but one of the things that I did want to talk to you a little bit about is perhaps a way going forward where things could be different.
Okay. What is that? What do you mean?
Well, what you could do if you wanted to is you could appoint what we call a substitute decision maker, and that person would be somebody who could make decisions on your behalf.
That sounds great. So what would I have to do to make that happen?
Well, what you'd need to do officially is to fill in some paperwork. But first, what we'd want you to do is to have a think about who that person is. So who would you like to make decisions on your behalf if you can't make your own decisions? And then to talk to that person about the sorts of things that are important to you and what you'd want to happen.
Oh, I think I would definitely want to make Jenny my decision maker. I mean, I just don't think that Mary and I are on the same wavelength. In fact, I'm not sure why she had to get involved at all. Okay, so if I'm hearing you correctly, you would like Jenny to be your substitute decision maker. Okay, so what I would suggest that you do is have a talk to Jenny about that so that she knows that that's what you'd like to happen, and to talk to her about what's important to you. I also think it'd be helpful to talk to Mary about your decisions as well. And that's something we could certainly help you with if you'd like us to. Rose and I went on to talk further about her preferences and about Jenny becoming her decision maker. We then completed her advanced care plan, including the appointment of Jenny.